the main question comes to what's my role in it? Me as a veterinary technician, me as a doctor in a clinic, a client comes up to me and says, my neighbor Sally gave this cannabis product to their dog Roger, and now he's not limping anymore. He's doing great. So I want to use it too. So I usually, when a client comes to me, and if you're in a state that doesn't permit you to discuss or things like that, you are allowed to provide harm reduction education. So typically when I'm writing in the record, if I was in a state that didn't allow me that, I would just say, provided the client with harm reduction education because they came to me and asked me questions about a CBD product they want to start for their pet that they have already purchased on their own. And then you would clearly write down, like, spoke to the owner about the pros and cons of starting and using a cannabis product, and then you kind of write that out. Never in your record do you want to write recommended, prescribed, or things of those nature, those triggering words. Just kind of just say that you talked about it, you spoke about it, you wanted to do harm reduction education, and the client is going to consider their options after you give them the pros and the cons, and just keep it like that. If you're in a state that does permit you to talk to them and guide them further, then you can be a little bit more clear in your documentation saying that you spoke with the client, provided harm reduction education, and that you recommended that the client not use that product because it was unsafe, blah, 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 and then be more clear in that way. Just kind of be careful with your verbiage depending on the state you're in, just so, again, no one's really regulating it and going to be on top of you, but just in the random chance that someone pops in, looks at your records, there's nothing that's going to indicate you in that way. I always like to get a complete history, as we all should always get a complete history on any of our patients coming in, just so does this animal is this animal anxious? Why is he anxious? Was he a rescue? Was there a history of abuse in his past? How is his current living situation? Is he on any sort of medications? Things like that nature. Just as an example. And then listing current medication that they're on. I mean, obviously, we're always going to list things like flea and tick medication, which is like fine. That's really not important to me as a cannabis counselor. I'm more interested on long-term medications and things of that nature that I would want to focus on. Again, we want to focus on the reason why this client is coming to us and requesting cannabinoid therapy. Did they hear it from their neighbor? Did they hear it online? Did they just see it in the store or did they try it for themselves and saw it was beneficial for themselves and want to kind of share with their pet? And then once we know they want to start it and target, we want to know why we're using it and what our goal is going to be. And we must also talk to the pet parent because you're working with both ends of the leash. So, for example, if you have an anxious pet, sometimes they're anxious because the owner's anxious. So there's many times where clients get service animals because they're like, oh, this is my service animal. I need him so I can be calm. But then, as often it is, the service animal is a wreck. I'm like, this animal needs a service animal for itself because it's so stressed out. Um, so sometimes understanding like, okay, so what is the home environment like? What are we doing at home? What's triggering your patient that's causing them to be stressed or have anxiety? And then working with them and saying, okay, we're going to start a cannabis therapy program. I need you to keep a really diligent journal to monitor this patient. Just let us know, like, is he sleeping? Is he eating? What's triggering him? When you're giving him the product, what do you see? Is he very sleepy? Is he very this and that? And then doing a titration. So in cannabis medicine, we don't have a set dosage. I know a lot of times when you buy commercial brands, and I'm not going to name some of them that are out there, they do start at a dosage around like 2 mgs per kg. It's what like this arbitrary dose they started working with. Typically, if I'm working with a tincture, I usually go drops. I go by drops, depending on again the milligram per ml in that bottle. And I will tell that owner either give like, a drop once a day for a week, and we'll see how it goes, and we can like increase from there, going from a once a day to a twice a day, or increasing the drops as well until we hit the perfect number for that animal. Because remember, every animal has their own tone. So if, Scruffy takes 3 drops twice a day and that works for him, and let's say he's a small 10-pound dog, if I have Lola, who's a 10-pound dog, but is maybe not as anxious as him, maybe she needs 1 drop once a day and she's great on that dosage and it's wonderful. So it's like monitoring the patient, seeing how they're doing, and having a client that's really going to work with them because there is this assumption that cannabis is all natural, it's safe, and it's going to be a cure-all. And it's going to fix a problem right away. That is not the case. So I usually like to debunk that with the clients, say like, this is going to be a work in progress. We have to work together really closely, communicate, titrate, and find the perfect dose for, your pet and the perfect balance. When it comes to behavioral attempts, when I'm using it for behavior reasons or anxiety, I like to incorporate some kind of lifestyle modification or some kind of modification component to it. So this way we can have more of a benefit. There's a lot of research that shows if you give, and we've also seen it clinically too, as well, that if you give an animal that has, let's say, they have a fear of thunderstorms, if you give them a cannabis product and then expect it to really just take the edge off and they'll be fine. They've noticed that if you do not do any behavior modification, it actually made them worse when it came to these thunderstorms. It like took them into a heightened state. It didn't really calm them. Versus if you kind of wind the animal down, like if you know a storm is going to come in the next day or so, because you watch the news, you prepared a room for them, a dark room, maybe with a white noise machine, something quiet, and you taught them this is where you're going to go when the storm comes, and then you're going to give them a preloaded dose a day before and then a day of another dose and then keep them in that area until that moment has passed. And then you're gonna have more of a better beneficial effect than you just threw some CBD at them and it says that's gonna fix the problem. It can actually make it worse. Which I've actually seen a lot of clients tell me that. They're like, oh, I tried it and didn't do anything. And when I asked them how they applied it, that's what they did, and so it didn't work. So you really have to have a diligent client that's actually going to follow instructions, do it correctly in order to have that effect. If that client isn't going to do that or not keep a journal or not, keep it informed with you, then that's probably not the right um, modality for that client or that patient. Um, and then again, always look at the third party testing, make sure it's a healthy product. And I always like to get baseline blood work on a patient that's going to be on some sort of CBD product because it will elevate the liver enzymes. So whether that be the ALP, AST. So I like to have it as a baseline. So if I start to see it creeping up in like 3 months from then we kind of keep an eye on it. And if it gets too high, then we kind of like wash them out for a little bit. So that's important to notate. And also notate anything else if they have any other comorbidities, like if they have um like blood pressure issues when it comes to like cats with like really bad kidney disease and you're gonna put them on something. I would definitely avoid really high THC products with those cats.